Good morning, you all. My name is Chen Wan-Huan, and this is Emma, Madi, Mandeep, Sheena, and Dee. We're from the Group 5, an organization working on behalf of Aboriginal and Torres Strait Islander people for their health and well-being. First of all, we want to take this opportunity to thank you for allowing us to come before the Board of Directors and CEO. Our objective here today is to present the 6 topics raised by the local Indigenous peoples as important factors that the Board of Directors and CEO must be made aware of to navigate the appropriate health service planning for them. The topic Holistic Care will be presented by Emma, Aboriginal Community-Controlled Health Services by Madi, Interdisciplinary Collaboration by Chewan, Intersectionality by Mandeep, Discharge Against Medical Device by Sheena, and last but not least, Political Imperative of Well-Being by Dee. Let's begin, shall we?
Holistic care can be defined as the act of health professionals attending to not only physical well-being of an Aboriginal and Torres Strait Islander person, but social, emotional and cultural needs as well, encouraging all individuals to achieve full potential, which would bring well-being to their community. However, there are several barriers that prevent holistic nursing from being performed, with contributing system and individual factors involved. Indigenous Australians face white privilege, systemic racism, assumptions, social disadvantage, and historic factors that inspire individuals to obtain the self-determination to care for themselves. These barriers must be eradicated to ensure Aboriginal and Torres Strait Islander peoples are entitled to the same treatment and privileges that every other Australian receives.
Hi, now we will look at the main health supporting services in the Indigenous community. Aboriginal community-controlled health services were the first established in Redfern in 1971. They are a local community-controlled process to take charge of their own health and well-being. There are a number of ACCH services in metropolitan, rural and remote areas across Australia. Fundamental concept behind ACCH services is to deliver holistic, comprehensive and culturally appropriate healthcare to the community which controls it. These are the main strengths of ACCH services: primary care, supporting services, funding, assistance, advocacy and policy development. Now I have used a DNA structure to demonstrate the position of ACCH services. With 43 years of experience, ACCH have become the most effective health service among the Indigenous community. With their strengths and strategies, they have empowered, educated and taken social actions to provide culturally safe and holistic health care. Therefore, we should acknowledge and continue to support ACCH services.
Interdisciplinary collaboration refers to offering health services by complementing each other's efforts with discipline-specific knowledge, skills, and individual competencies as a team of health professionals, community workers, and Aboriginal and Torres Strait Islander community members. The foremost responsibility of the Indigenous health worker is to act as a liaison officer between the client and the other health professionals in the team. They map out patient care goals and interventions for achieving them. The worker also provides care and support to the patient's caregiver and family, offers guidance on relevant educational services, identifies and shares the social and cultural realities. Active presence of the Indigenous health worker improves the team's image, acceptability, and accessibility among the locals so that they seek healthcare with trust and confidence. The health professionals get clearer understanding of client condition, leading to accurate diagnosis and care interventions. Also, members of healthcare team, who could be strangers in this community, get to learn the cultural aspects of the Indigenous community. Unfortunately, we see some limitations in their roles. The worker may be incompetent in understanding some health complications the team is handling due to lack of medical knowledge and experience. On the global scale, the interdisciplinary team's collaborative efforts may be frustrated by the entrenched socio-cultural and historical impacts of racism and institutional discrimination. Also, sometimes the healthcare team, a health worker, gets blamed for the wrongs committed by the team. How do the nurse and the Indigenous health worker optimize each other's role? First, they should understand and complement each other, resisting all forms of competition. Whenever conflicts arise in the course of service, the two workers should learn to resolve them speedily and amicably. Moreover, they should also promptly share pertinent cultural and professional information respectively. Empowering each other with critical knowledge ensures that work is done with minimal hindrances.
Hi, I'm going to tackle the intersectionality in Aboriginal and Torres Strait Islander LGBTIQ community, which is lesbian, gay, bisexual, transgender, intersex, queer, or the brother boys and the sister girls. LGBTI community faces intersectionality, and by this we mean the multiple discrimination and marginalization experienced by some members of the LGBTIQ among Indigenous community. And in this case, the Indigenous LGBTIQ group, they feel discrimination not only on the basis of their race or background, but because of their gender identity and sexual orientation. There are some health concerns regarding this community. The first one is homophobia or the transphobia. This is due to the differences the community experiences from the rest of the population, as they develop this fear as they feel ashamed of their gender identity and don't feel comfortable in accessing healthcare. The second one is the high rate of mental health issue. This is due to homophobia that leads to the mental health issues as they develop disorders such as anxiety and depression. Third one is high rates of self-harm and suicide. Suicide rate is higher in this group, especially those living in rural and remote areas. And the last issue is the high rate of the STI or the STD, which is the sexual transmitted diseases. This is due to poor accessibility of healthcare and the lack of reproductive health education. There are two services available to respond their needs. These are the Black Rainbow and the Two Spirits. They encourage the health education among this Indigenous group and in preventing the sexual transmitted disease. Thank you.
Hi, I would like to discuss about discharge against medical advice or DAMA. It is also known as self-discharge. It happens when an inpatient leaves the hospital without the approval of the treatment team. For health professional, it's an ethical dilemma since it is necessary to respect the patient's decision, but this can lead to morbidity and mortality. For patients, it's the right to get adequate treatment, but because of DAMA, they put themselves at risk. Data shows that Indigenous people are 8 times more likely to discharge than non-Indigenous people in Australia. This graph clearly shows the proportions of hospitalization ending in DAMA, and it is very high in Indigenous people. These are the factors associated with DAMA. These can be ranged from personal circumstances to hospital-related factors. One of the strategies to reduce DAMA is cultural competence training. It can be done by ongoing cultural competence developmental activities, reflective practices, and face-to-face training. Progress can be checked either by direct feedback from Indigenous people or by indirect approach, like collecting the data of DAMA. This training can benefit by increasing the Aboriginal people's access to healthcare, reducing the occurrence of DAMA, increasing the effectiveness of care, and decrease the health disparity between Indigenous and non-Indigenous health. Thank you.
Hello everyone. Let's have a look at the political imperatives of well-being, which includes social justice and human rights for Aboriginal and Torres Strait Islander people. It also includes patient advocacy, which is addressed by Social Justice Commissioner and the registered nurses as advocates. Social justice. It can be defined as a concept of acknowledging inequalities and disadvantages, attempting to alleviate it through proactive policies, rights, positive discrimination, and appropriate services. It also recognizes the distinctive rights that Indigenous Australians hold as the original people of this land, which includes the rights to a distinct status and culture, the rights to self-determination, and the rights to land. We have Social Justice Commissioner for Aboriginal and Torres Strait Islander people. She is named as June Oscar. She works to advocate for the right of Indigenous people, and she promotes an Indigenous perspective on different issues. What is patient advocacy? It is defined as an interactive process of analyzing, counseling, and responding to patient care and self-determination preferences. Nurses also play a role of patient advocates. The role of advocating for patient involves the nurses to become the defenders and promoters of patient rights. This role provides the nurses with the ability to defend against ethnic and racial discrimination that result in differential treatment deliveries. nurse-led interventions are the most suitable for providing healthcare as it reduces inequalities because they encompass culturally tailored approaches within their practices. This brings us to the conclusion of our presentation. Today we looked at holistic care, Aboriginal community-controlled health services, interdisciplinary collaboration, intersectionality, discharge amongst medical advice, and political imperatives of well-being. Even after addressing these issues, there are still a lot of improvements to be made. Finally, I would like to thank the Board of Directors and the CEO for giving us this opportunity to look at such vital issues. Thank you.